Hello viewers, right in the middle of this pandemic there is a number of heroes that we might be missing, but amongst these heroes there is definitely the medical field, the medical practitioners and all the paramedics as well, who have done a great service to humanity. And we thought it best we talk to Dr. Belani, who has been in this industry of shipping for several years. Doc, tell us, how long have you been with the shipping?
Captain Chadha, thank you for first appreciating the services provided by the healthcare industry in these times of pandemic. I have served the maritime industry now for 4 decades. It's been a long time.
4 decades, that's 40 years, very long time I should say. So Dr. Belani's experience, his knowledge and his background will be very useful in taking our interview forward. Listeners, viewers, please stay in. We're going to dive straight in and start with Dr. Belani. Doc, we'll start with, how do you feel about the stories we've heard about the mental health situation in this pandemic? How can we differentiate this condition from the normal times? We're talking of seafarers in particular.
The seafarers have been very insecure regarding contracting COVID infection whilst on board and serving on board. Perhaps because they feel they may not get adequate and appropriate treatment on board. There are difficulties for accessing port health authorities, health services ashore. Most of the countries do not give permission to land a seafarer ashore for specialized care. So these are the insecurities that we have come across, that seafarers have shared with us, and these are genuine, and we try and do our best by providing radiomedical advice in time.
So Doctor, what are the major challenges that you have faced in this current state of the virus while dealing with seafarer health?
The first one is insecurity, and every seafarer, whoever has had cough, sore throat, fever, has assumed that he has had COVID, and that has compounded the already enigmatic situation. However, we are trying to do our best, reassure them, motivate them, and most of them have come around and turned back to good health and back to work.
So it's kind of scary the way people have reacted, but you would say that that's pretty much how any human would react if they were confronted with these symptoms.
Absolutely, and particularly if you are detached and so far away from shore, home, family, the reassurance, the cocoon of your security. Yes, of course, it's absolutely natural to behave and react like this.
Yes. So what percentage, Doc, you figure that of seafarers who might have contracted it whilst on board?
Well, I do not have exact statistics in percentage, but during the second wave that we've had from end of March till end of June, those seafarers who joined out of India, I would say at least 2 to 3% of them evolved and manifested frank COVID, which is a big number. 2 to 3% on board, no healthcare facilities, only radiomedical advice, shore help not coming forward so easily.
Yes, very, very difficult times, very difficult times. So is there any particular critical feedback you have received from the seafarers or from people ashore that, Doc, can we also do this please, or this is something that we are missing and if you could help us with it?
Some of our principals where we provide professional services have now got a special COVID medical kit on board. With antiviral medication, they've had additional supplemented supplies of medical oxygen. We had one case of COVID. By the time the ship could reach the shore, we had to use oxygen which was not of medical grade. But however, the person survived and we are very happy he's doing well even now. So there have been medical kits specifically designed to treat COVID, as good as what we would do here. They've had supplemental oxygen, and I think these are the things which have helped a lot, and these principles have seen a decline of fatalities or morbidities on board.
So have you recommended these particular kits, or have you actually supplied them?
Both. We first recommended a list of inventory that should be on board, and then these principals requested us to provide based on the number of seafarers on board. So we've done both.
Great. I'm sure all of us go through all kinds of mental stress, but I can assure you the kind of mental stress doctors go through on a 24/7 basis is really very difficult, very difficult and very challenging. So what I want to ask you now, Doc, is how do you manage your own stress levels?
Well, yes, the stress levels had been extremely high during the second wave, both ashore and from the ship, and I learned to cook during this second wave. That was a very creative hobby which I always thought I wanted to do, but my wife came forward and taught me some very good dishes, and I can be now self-sufficient. And I've taken up to yoga during these difficult times, which has helped to stay calm, flexible and focused. And reading and these streaming channels have given us enough entertainment to deviate from our normal day-to-day stress.
Doc, yes, this has been very stressful, the COVID period, but generally tell us how has Blue Shield over so many years, over the decades, how have they contributed to seafarer health?
To seafarers' health, we have evolved as and when the situation came. We've had the first episode of SARS, then we've had Zika, then we've had H1N1, the swine flu. So there have been endemics and epidemics, and we have dealt with effectively. But a pandemic, this is the first time we have faced a pandemic. So our 1:1 counseling of every seafarer has been a little more intense during this time. So we've advised them, counseled them regarding motivational ways to keep them positive, and also good lifestyle changes, and what we call now as a COVID appropriate behavior.
So, Doctor, there are many new companies that come into the field, and they are always looking for medical assessment of seafarers. So, what would you recommend to a new company, that these are the factors you have to consider, not just his licensing and the licensing by the DG, but definitely there's more factors to look at before you narrow down on your options?
So I would say cost-effective, quality care. Every ship owner and manning agents is looking at cost cutting. So I would not say cutting, I would say cost-effective excellence in healthcare. With our experience over the years, we have been able to come to the forefront and provide solutions to that. Why would anybody choose to come to our facilities? We provide transparency, integrity, and we are very motivated and dedicated to whatever assignment is given to us.
Very good, Doc. And what's the number of your staff here, and where are your clinics located?
We have 3 facilities, one here in Colaba, which has been our foremost facility we established, one in Andheri East, which is now the shipping hub, and we have one in Goa, which is also a hub for seafarers.
So, viewers, in closing, I will request Dr. Belani to tell us what are the 3 words that best describe him.
Well, I would say it's a teamwork that we have put forward all these years. So I would say integrity, transparency, and our dedication to work.
Thank you so much, Doc. Thank you so much. Really appreciate your time, and I'm sure our viewers will have much better knowledge of the great work our doctors are doing. And I think, as we can see, for the near future, we will be requiring them by our side, standing by us and helping us at sea and ashore. Thank you very much. Bye-bye.
Thank you, Captain Chadha.